Hi, this is Dr. Luke at ClearSight Center in Oklahoma City, and this is how I perform the ICL. So we start by getting the lens ready. Start first with VSS inside the cartridge. And then the next thing we place is viscoelastic, or in this case, OcuCoat. Now, I then use a cotton tip plunger in order to remove the ICL. Bring it slowly toward the front, rotate it forward, and then place it onto the cartridge with the same cotton tipped applicator or plunger. Then use a forceps in order to further load the ICL onto the cartridge. Tap it down so as to make it easier to grab with this forceps. And then coming from the other side, I pull the ICL through almost to the end. I don't want to pull too far, as I only want the ICL to go in one direction. Next thing I do is make the paracentesis, or the small side port, into the eye. Inject preservative-free lidocaine in order to numb the eye. Then inject viscoelastic or OcuCoat in order to keep the eye inflated for the next incision. Now you can see a faint purple mark on the eye, and this is where I place the primary incision. This is on axis so as to treat the patient's astigmatism. This was a 3.5 millimeter incision. Inject more OcuCoat, and then I place the lens inside the eye. It is rolled up similar to a taco. And I make sure to place the foot plates anterior or in front of the dilated pupil, or in front of the iris. Inject more viscoelastic or OcuCoat in order to protect the cornea, making sure not to touch the optic itself. I then use the manipulator in order to rotate the eye, perhaps rotate the lens horizontally. I then use it to tuck in the foot plates, most of my side port, and there are 4 foot plates, and here you can see the last ones being placed. This is number 3, and there is number 4. I then inject VSS, followed by Myocol in order to make the pupil smaller here. Some steps have been omitted just for time's sake. I use VSS to remove the remaining viscoelastic. I check the wound to make sure that it's watertight. And that is it. The patient is on his way to great vision. Thank you so much.